Lateral hip pain occurs in lots of people. Now, the lateral area of the hip is the outside of the buttock area, and people often assume it's due to arthritic change because it hurts when they're walking, but there are quite a number of soft tissue issues that can be caused in this area. Now, today I'm going to concentrate on Trochanteric Bursitis. So, within our body, where there's bony prominences, there are little fluid-filled sacs that allow tendons and other soft tissues to move smoothly over the top of them. The most commonest ones that we can see and actually move ourselves are on our elbows, where we can move the olecranon bursa around, and that's why the skin's so mobile there, but also on the front of our knees there's bursas there. Now, the one I'm going to concentrate on today is the Trochanteric Bursa, and that's the bursa that sits over the bump on the outside part of the hip. That can often get inflamed and give pain around that area. People dislike sleeping on the side. They tend to find that if they bring their leg across their body, it's more uncomfortable. However, usually the range of motion or the movement of the hip is fully maintained. Now, with Trochanteric Bursitis, it can come on gradually or it can come on quite suddenly. Sometimes it's related to increasing activity, but there is an incidence of it with heavier set people. So if you're carrying more weight, you tend to put more pressure over your hip area and you tend to be at higher risk of getting Trochanteric Bursitis. There's different ways it can be investigated. Most times it can be made from a clinical diagnosis. However, sometimes if it's been persistent for a long time, it's worthwhile getting further scans, either an ultrasound or an MRI scan, which allows us to look at the soft tissues in greater detail in that area. Now, sometimes there's other things that can be caused there, namely things like tears to the gluteus medius tendon, which is a tendon that comes onto the top of that bony prominence on the outside of our hip, or it can be due to inflammation within that tendon. And sometimes other soft tissue problems in the area, or a problem with the hip itself that's giving lateral sided hip pain. Now, the treatment for Trochanteric Bursitis can involve, first of all, physio with doing stretches to try and stretch out the tensor fasciae lata, which is the structure that lies on the outside, which is the tendon that's pulling down on that bursa. Now, this can sometimes help. Icing can help. Anti-inflammatories such as ibuprofen, naproxen can help, as long as there's no reason why you can't take it, because you haven't got things like asthma or gastric or stomach problems that would prevent this. And those are the simple measures that you can usually initiate yourself. If you look on YouTube, there are various physio videos that do show how to do trochanteric stretches or stretches of the tensor fasciae lata. Now, the next stage of treatment, if that's failed to improve things, is a targeted steroid injection. Sometimes it can be just done clinically in the outpatients, or sometimes it can be done via ultrasound, where the radiologist will look at the inflamed area and do an injection down on top of it. Now, with any steroid injection, that it can sometimes wear off. Usually in my practice, I'm willing to do up to 3 sets of injections because there's a cumulative effect from doing steroid injections because it alters the soft tissues due to the chemical nature of the steroid, as well as the anti-inflammatory effect. And if this fails to improve things, then sometimes surgery then becomes an option. Obviously, if you'd like to discuss this further, then please make an appointment and I'll happily see you and we can talk about things if you've had trouble trying to settle your own Trochanteric Bursitis down. Thank you.